This is one of the best conversations I've had with a doctor in a long time.
Yeah, it's important to you because you experience these things.
Yeah.
Absolutely. Yeah.
You know, and my kids have experienced them too, right? Growing a Healthy Child, where we help busy parents grow healthy kids with less stress and more joy. Well, hello, here we are again at 6 Million Seeds. We have a great episode lined up today. My name is Meryl.
My name is Carrie.
And today we are working and speaking with Dr. Mike Hollie, an asthma allergy specialist in Tennessee.
Correct.
Wow, far away from Wisconsin you are, my friend. Which is probably a good thing weather-wise.
Yeah.
Yeah.
Yeah, it was lovely getting the chance to meet you at the CNS retreat. And yeah, just getting the chance to talk with you, figuring out what you're doing, and knew we had to have you on the podcast.
Well, it's a privilege. And yeah, it was great getting to meet both of you in Tucson when we had the CNS retreat out there. Enjoyed your presentation as well.
Oh,
Yeah,
thank you. It was a pleasure to have you in the audience. It's always good to have a knowledgeable supporter. Yeah, helping us move the topics along. That's great. So just in case people don't know, CNS is the Center for Nutrition Studies, the T. Colin Campbell Center for Nutrition Studies. Got to make sure we clear up our acronyms for people.
Yeah, they might think it's central nervous system.
They might.
There you go.
Right. Or Central Nebraska State University. Something like that. All right. Well, let's jump into some questions. We got a pile of stuff to ask you about.
So to get started, can you tell us a little bit about your background and how that led you to what you're doing now with asthma and allergies?
Yeah, so honestly, the specialty that I have, which is allergy, asthma, and immunology, probably wasn't a major factor in nutrition. I just always had a passion for how nutrition and health and that sort of thing all interacts, and my wife shares that same passion, and so the two of us together have sort of been on this journey of trying to get to optimal health, realizing that nutrition is a major portion of it, but it's not the whole package. You need other factors as well, and not just exercise, because most of my patients, when I talk to them about health or weight or whatever, they always go to exercise, which is great. We absolutely need exercise, but they leave out nutrition and sleep and fresh air and sunshine and de-stressing and all those other things that are critical for health. So yeah, my wife and I, we saw a movie that you all have heard of called Forks Over Knives. And then I read a book that really changed my life as far as my approach. And that book is The China Study by T. Colin Campbell and his son, Tom Campbell. And as I read that book, one word just kept, as I turned the pages, is like, this is fascinating. And I've never been taught any of this in medical school or training or anything like that.
Exactly.
So, and then my wife was, she's a great cook. And so she began modifying things and sort of told me that we needed to stop eating certain things, even though we were already like vegetarian or whatever. But we continue to refine what we do in our life, whether it be our nutrition or our exercise or de-stressing and those sorts of things. So it's been a team approach, my wife and I together, on this journey of continuing to learn about nutrition and good health.
Yeah.
So you also do you have a program, yes, that you put on. Tell us a little bit about that too.
Yeah, so that's Dinner with a Doctor, and I'll just plug our website right now. It's dinnerwithadoctor.com, pretty easy. And it's an educational and yet instructional type program. So you can give people lots of knowledge, and that's really important. It's important to give good, accurate, unbiased, scientific-based knowledge. But you've then got to teach them how to incorporate that into their life. Because I can tell you, eat more fruits and vegetables, eat less meat and that sort of thing. But if you don't teach people the recipes, how to put it into their lifestyle, it's just simply knowledge that isn't being used. So what we do with Dinner with a Doctor is we serve them a whole food, plant-based meal. I give a presentation on some sort of health aspect. It might be heart disease, it might be diabetes, it might be weight loss, it might be Alzheimer's, it may be why do we get sick and what should we do about it? Many different topics that we have. And then we also have cooking demonstrations where we'll have various people teach not only how to cook it, but where do you buy this food and what are some of the different ways you can do it? And how can you use this in a busy lifestyle? Because it's real easy to give somebody a recipe with 15 ingredients and it takes an hour and a half to prepare, tastes great, but how do I do that day to day? Because, you know, I work and I have children to take care of and school or whatever else. So we teach them how to put it into their lives in a practical sort of thing. We've even had episodes where we will take them shopping, that sort of thing. We have sessions that are just dedicated to learning to cook. In other words, we have different stations, different cooks that will come in and they'll teach them different ways to prepare food, how to do what's called batch cooking. Many of you are familiar with that, where you know, pick a day of the week, you kind of cook forward for several days and have food already prepared so that you don't get in the situation when you come home from work or school where I'm just going to grab something easy. I'll grab a, you know, fast food on the way home. No, I've got something prepared at home that I can go home to and warm up and have a good nutritious meal. So yeah, it's a practical educational type program that we do. We're actually getting ready tomorrow to start an 8-week course called Creation Life, and it incorporates all the aspects of health that we were kind of mentioning before. Specifically, we're going to talk to them about choice. What sort of choices do you make in your life, and how does that affect your health? We're going to talk to them about rest and sleep. A lot of people overlook that as a key health component, so we're going to talk about that. We're going to talk about environment, which was interesting. You know, all your senses, your sight, your smell, your taste, your feel, those sorts of things, how your environment influences your health. We're going to talk about activity, exercise. There it is. It's part of it. We're going to talk about trust in God or in other aspects where you can kind of de-stress your body. That's important as well. Interpersonal relationships is going to be another session where we talk about how people interact with each other and how that affects health. Outlook is another session, which is really important. Your attitude. How do you approach life? Are you an Eeyore or are you a Tigger? You know, depending on which one you are, it's going to affect your health. And then the last one, because it spells the word creation, the last one is in nutrition, which of course is my favorite. And so when you put all of those aspects, it's mental, physical, and spiritual health. All of those work together. So that's our Dinner with a Doctor presentation for the next 8 weeks. Then we'll go into some of our regular sessions where we'll cover heart disease, diabetes, weight loss, Alzheimer's, living longer, that sort of thing.
Yeah, I really love that approach. It brings in so much more than just the typical things we think about, like nutrition and exercise. Yeah.
Exactly. And 9 times out of 10, if not 10 times out of 10, if I start to talk to a patient about their health, you know, outside of what I'm maybe seeing them for that day, the first word they come in, well, I haven't been able to exercise because of A, B, and C. And I say exercise is super important, but if you don't get these other components in there as well, you can exercise, keep eating the bad foods, not get results, and wonder why I'm not getting results.
Right.
Yeah.
Right. So true. So in those sessions, do you wind up seeing the same people come back over and over, or do you kind of get a new crop or new body of students every time?
Yeah, that's a great question. And it's a little of both. And that's a common question that I'll ask at the beginning of a session. How many of you are here for the very first time? And it's typically about a third or a little bit more that raise their hands. Hey, this is my first time. You get some people that will come regularly for a while, then they'll disappear, then all of a sudden they'll show up again. Quick story, I had one lady, she had been to Dinner with a Doctor, and she was also a patient of mine, and she kind of disappeared for a little while, and then she showed up at the office, and I didn't even recognize her. She'd lost like 80 pounds.
Wow.
Wow.
And I said, wow, what have you done? And she just quite frankly said, well, I did exactly what you told me to do. So,
Nice.
you know, I love it. I mean, I wish everybody could be that way. I wish all
Right?
patients could be that way, but it was just, she was just very matter of fact, well, I did what you told me to do.
Right.
So some people, you plant the seed and boom, they do the rest of the nourishing of that seed. Others, you've got to nourish, you know, you got to take them along every single step.
That's right.
But dinner with the doctor kind of helps recharge them. So even if they drift away for a while, then when they come back, it sort of recharges. Another component of dinner with the doctor is testimonies. We have people, you know, that are doing this in their lives. We interview them for 5 or 10 minutes before a session, and it makes it real because it's not all just about the success. It's also about some of the failures and, you know, struggles that they have. And that helps other people say, oh, okay, good. I struggled with that. I thought I was the only one.
Yeah.
So when they hear, you know, real life experiences and testimonies, that's really helpful as well.
Yeah, for
Yeah.
sure. Yeah, that's great. Beautiful.
Mhm.
All right, now we're going to start asking you questions about allergies because
We have so many.
we do. All right, and you have like the two ends of the spectrum.
Yeah,
here.
yeah. So I luckily, knock on wood, have never really had any allergies or intolerances and currently don't. And
I
she has plenty.
seem to accumulate them every several years. I get a new one.
They keep popping up.
Yeah, it's so much fun. So we have a whole, this is gonna be interesting. So looking forward to this. So one of the first questions I have is, all right, so as I understand it, I was probably born with some sort of a dairy milk intolerance, right? And we know that so many people in the world, I don't know, 80-95% of people in the world seem to not be able to manage cow's milk, and appropriately so, right?
Right.
How would you recommend that a family start? Say they have an infant or their mom's pregnant, hasn't yet delivered. How would you recommend a family start feeding, even with breastfeeding? You know, is there anything that they need to know to probably sort of try to protect their child from getting what I got, which is, you know, gradual accumulation of allergies?
Yeah, good question. So of course, the ultimate recommendation for babies is to be breastfed. I mean, that is absolute number one nutrition for babies, is to be breastfed. And duration, that's going to depend on mom and baby. You know, some will do it for several months, some will do it for a year, some will go into toddlerhood. So that's really up to mom and baby as far as the duration. Typically, the classic pediatrician recommendation is going to be when they hit around 12 months, then you introduce them to cow's milk. They don't say milk, they say cow's milk. And so my recommendation for my patients is don't start cow's milk, but rather if you need a milk beverage or whatever, then look at almond milk or soy milk or coconut or cashew, some sort of plant-based milk. Oat milk is another real common one now, and it actually tastes pretty good. I was surprised, but but it is. So there's lots of options. You know, 20 years ago, we didn't have those options. I mean, now we've got lots of plant-based options. So I recommend that. Some welcome that, and it's interesting, a lot of them are already doing that. Even though the rest of their diet may not be plant-based, they kind of recognize what Meryl was talking about, the fact that a lot of people don't tolerate cow's milk for various reasons. And I'll mention that there's really three aspects of cow's milk that we need to be aware of. One is lactose intolerance. Lactose is the sugar in cow's milk, and you have to have an enzyme called lactase to digest that. And many people, and you alluded to that, 80% or more, don't really have a full amount of that lactase enzyme. So they tend to get some cramping and some diarrhea and some gas and that sort of thing. And so that's lactose intolerance. And a lot of my patients will say, oh yeah, I'm on lactated milk. And I'm saying, well, let's talk about the other aspect of cow's milk, and that is the cow's milk protein. And we know that cow's milk protein can present with a true anaphylactic type allergy. And that's where you have to have very strict avoidance of cow's milk. And so keeping that out is important. And then there's this sort of gray zone of cow's milk causing increased mucus. I have a number of patients who have told me that, you know, Meryl, you're one of them. Yeah, that when I drink cow's milk or a cow's milk related product, I tend to get more mucus and congestion. And I'll hear this a lot. People say, when I stopped milk, my allergies went away. Well, they may not have had the true definition of allergy, pollen allergy, dust mite, cats, molds, etc. They may have had simply this intolerance to milk where it causes congestion. There's not a lot of science there. I found a few kind of, I'm going to call them anecdotal papers and studies on this because I've researched this in the past trying to figure this out, because I also had a child who, you know, back in the day when we were lacto-ovo vegetarians, he was drinking milk, had this mucousy cough all the time, figured out and took him off of it. I think it was probably my wife figured that out, and then boom, it went away. So lots of reasons to not introduce cow's milk as the primary beverage at 12 months. People are under the impression that there's some significant nutrition in this cow's milk that you need to have, which is not true at all. And, you know, the three of us know that cow's milk is for baby cows, right? Not for humans. That's why we call it cow's milk. So, and then there's several studies that have looked at cow's milk and eczema. And one study found, it was quite interesting. One study found that even in those children who did not test positive to cow's milk or egg in an allergy test, removing cow's milk and egg significantly improved their eczema. So there's another example of where cow's milk is not helping us at all. And then another area where cow's milk tends to be a problem in children is constipation. I'll see children, and again, I'm not a general pediatrician. I did train in pediatrics. I was a pediatrician, then I did allergy and asthma and immunology. So, but constipation, and typically, you know, child presents with constipation. What does a pediatrician do often? Oh, you need to go on some Metamucil, you know, and so they,
Miralax.
Pardon?
Miralax is another.
Miralax, exactly. And so instead of saying, all right, let's look at your diet, how much fruit and vegetable and fiber containing foods that help move bowels and that insoluble fiber that helps move through, and how much cow's milk and cheese. Those two things, cow's milk and cheese, tend to be very constipating for children. There we go. So first of all, asthma is the most common chronic disease in children. You ask the pediatricians, they treat asthma all day long. I mean, that's what I do, of course, in my office as well, but it's a very common issue. This was for lack of a better word, a huge study, over 1 million children, 233 centers, 98 countries. So it was all over the world. And what they discovered when they call it the ISAC study, International Study of Asthma and Allergies in Childhood, 20 to 60-fold differences in prevalence in asthma and hay fever and eczema and things like that, depending on what part of the world you were in. And so that told these researchers, hey, there's some sort of environmental, you know, characteristic that is determining these differences. Because, for instance, for regular allergies, hay fever type allergies, that's rhino conjunctivitis, rhino nose, conjunctivitis eyes, anywhere from 1 to 45% difference. So, you know, you can't blame it all on the genes. You got to wonder, you know, what's going on there. And what they found when they started teasing all this out was the most significant associations seemed to be dietary differences. And so they found a decrease in symptoms of asthma and rhinitis and eczema with an increased consumption of calories. These children were getting their majority of their calories from cereals and rice and nuts and starchy vegetables and vegetables in general. So it was sort of inverse. You get a decrease in symptoms with an increase in calories from these plant-based foods. And what another study found was an association between increased asthma and decreased consumption of fresh fruits and vegetables and other dietary antioxidants. And so antioxidants are substances that help reduce oxidants in the system, right? Makes sense? So oxidation is a normal metabolic process that goes on in our body. It is, we have to have oxidation, and it's a byproduct of our metabolism. But if your body cannot sort of clean out those oxidants that, by the way, are damaging to our body, if we don't have antioxidants enough in our body to take care of it, then your body goes into something called oxidative stress, which can lead to all kinds of illnesses and inflammation in the body. So where do we get the exogenous sources of antioxidants? Fruits and vegetables. In particular, the colorful ones are very important. So the more colorful a fruit or vegetable, the more antioxidants that they're going to have. So in this particular study, they found that the more plant foods they were eating, the less asthma and respiratory symptoms that they were having. Now, on the flip side, if you were eating diets high in fat and sodium and low fiber diets, and just a reminder, fiber is only found in plant foods, not found in animal-based foods. If you're eating diets that are low in fiber, high in fat, high in sodium, then there was an increase in what we call bronchial hyperreactivity and asthma. Bronchial hyperactivity translation is overreactive, too sensitive, too twitchy lungs. So they become more sensitive to things like allergens and viruses and bacteria and cold air and smoke and irritants. So eating the wrong diet and not eating the right diet, both of those things can have significant effects. Similarly, consumption of sweetened beverages, and I'm going to include in there, because I just like last week read this study, including 100% juice, because many people are under the misconception that because it's 100% juice, it must be good. Well, if it's 100% juice, it's 100% sugar water. Yeah, it came from an orange or an apple or whatever, but it's still a sugar beverage. So consumption of sweetened beverages and eggs were associated with increased risk of asthma and respiratory symptoms. And in this study that I just read last week, the children that were consuming more of the 100% juice had a higher, I think it was a 2 to 4-fold increase in asthma prevalence. So again, these studies start to build upon themselves. And then consumption of soy products, fruits, actually reduce the risk of respiratory symptoms. So we're seeing a theme here. Here's another one that looked at removal of eggs and dairy over an 8-week period, and it reduced atopic or allergic symptoms and improved lung function in asthmatic children. We've seen similar results in eczema as well. And then fruit intake inversely associated with wheezing and rhinitis or allergies. And again, so the more fruit you eat, the less wheeze, the less rhinitis that you had. Dietary changes have led to, reduction in antioxidants, because yes, dairy and meat, they have some antioxidant, but they pale when compared to fruits and vegetables and antioxidants. So the more antioxidants we can get into our system, the better off we can do. So oxidative stress, I mentioned that a little bit ago. That's where your body is literally stressed out from too many oxidative byproducts that are not being cleaned out of the body by antioxidants, will cause airway smooth muscle contraction, a hypersecretion of mucus, epithelial shedding, vascular exudation. That's where fluid comes out of the vessels into the airways. And then this airway twitchiness that I mentioned before. All of these things are a result, if I were to put it into one word, inflammation. It's inflammation of the airways. And so, as I mentioned before, there are endogenous antioxidants that we have built in that our body makes. Superoxide dismutase is one of them. Glutathione peroxidase is another. And then the exogenous stuff, the vitamin C's and E's and carotenoids and flavonoids. And don't go to your store looking for, vitamins and carotenoids in a pill and flavonoids. Eat a whole food plant-based with lots of fruits and vegetables. You're going to get all those exogenous antioxidants that you need. And then this was looking at FEV1. This is airflow, forced expiratory volume in 1 second. So when we do a lung function test, it measures how much air we blow out of our lungs in that first one second, and that measures obstruction in the lungs. And what they found is when they placed asthma patients on a low antioxidant diet, so they were just getting like 1 serving of fruit and a couple servings of vegetables for 10 days, they had significant worsening of lung function and asthma control score. Those that were on a high antioxidant diet, 5 vegetables, 2 fruits per day, which I'll be honest with you, I still see that as a low antioxidant diet, you know, 5 vegetables, 2 fruits, but hey, that's better than the standard American diet. And then they compared it to the low antioxidant diet, less than 2 vegetables and 1 fruit. And that's probably a pretty typical standard American diet right there. They found that the exacerbation rate, in other words, how often they had an asthma flare-up, was significantly lower, 20% versus 40%. So those getting the high antioxidants had a much lower exacerbation or flare-up of their asthma. So just some ways, because it's easy for moms and dads to say, eat your fruits and vegetables, you know, that's what we need to do. But science is showing us that there's reasons to eat our fruits and vegetables, and it's not narrowed down to just 1 or 2 things in these fruits or vegetables. It's multiple things. So let's not be reductionist and try to figure out which 1 or 2 you know, chemicals in this fruit or vegetable is beneficial. Use the whole fruit, the whole food, the whole vegetable, the whole grain, the whole bean. That's where you're going to get your most benefit. So that I think is all. Yeah, well, okay. So there's one more thing that I just wanted to mention if we have a minute. So we were talking about the microbiome earlier. And this is just fascinating, but there's a substance called trimethylamine oxide. And this is a substance that comes from when meat and eggs and dairy are digested, specifically from something called carnitine or choline in these foods. And let me pause and say, we need some choline in our bodies. Helps transmit energy into our cells. We need some carnitine, but we're getting way too much in meat and eggs and dairy. And what happens is this substance, carnitine and choline, are broken down in our gut by our gut bacteria, our microbiome that we were talking about, and they'll convert this choline and carnitine into something called trimethylamine. Then through our liver, it gets oxidized into trimethylamine oxide, TMAO. And what happens is this TMAO has been in high levels shown to increase heart disease, certain types of cancer, inflammation in general. So where I'm going with this is it gets back to our gut microbiome, because if you take a vegan who has not been eating any meat at all, and I can't imagine doing this now, but and then you feed them meat, they will not produce the TMA because their gut bacteria are not the same as meat eaters. And so therefore they don't have the ability to convert that carnitine and choline into TMA. And so pretty amazing how our microbiome influences disease. You know, we talked about earlier how it can influence inflammation and even allergy and things like that. Here's another way it can influence heart disease and things. So all the more reason to skew our kids away from the animal-based foods and get them skewed toward the plant-based foods.
Are you a parent or caregiver who is unhappy about how your child eats at home?
Wouldn't it be great if you were part of an active, well-informed, supportive community where you could work to transform how we feed our kids so we could make a difference for them and for the planet as a whole?
Well, you can. That community actually exists.
It's a thing.
It is. Join us and get involved. Become a member of Plant-Based Nutrition Movement. There's no cost to join. Join the 6 Million Seeds Coalition and launch a 6 Million Seeds project in your area. Contact us at 6mseeds@pbnm.org.
We want you there. It's frustrating, I guess.
Yeah.
You know, to have different things going on, little sensitivities that you notice. And of course, we test them and we test them again and we test them again. I think once you get to be an atopic person, you have a little checklist that you go through of how you test if you're, is this something I'm really sensitive to? And over time, when you mention to your family, guess what? I think this friend of mine, I think I'm sensitive to raw apple, and her husband's like, what? Another one?
Crazy.
Can you please stop now? My family actually tells me, mine are psychosomatic. I get them, I select the allergy that I'm going to have next is the thought. And I implement it because it serves some great purpose. I don't know.
Yeah, so Meryl, you just hit an array of things that I think we should talk about just in the last few minutes that you mentioned. One is I appreciate the fact that you're using the word sensitivity rather than taking allergy as sort of the overarching for every little reaction we have, because allergy is your body's immune system overreacting to otherwise harmless substances. So tree pollen's harmless, but if you have an allergy, your body's overreacting to it. Cat dander is harmless, but if your body overreacts, it becomes a real problem. Peanuts are harmless unless you have allergic antibodies. So a true allergy is where you have an allergic antibody. Those are called IgE, immunoglobulin E. It should be A, but it's E. When you have allergic antibodies to whatever that substance is, that's a true allergy. So a child comes in and the history is that he or she consumed peanut butter for the first time. They broke out in hives and a rash and maybe started coughing and wheezing and had to take some Benadryl and rush to the hospital, that sort of thing. We test them, they're allergic to peanut. That's an allergy to peanut. Now, on the other hand, somebody might have, I'm going to use gluten because that's a real common one, right?
Sure.
So someone may say, I'm allergic to gluten, and then we'll test them and they're really not allergic to it. Then we start looking, maybe they have an intolerance to gluten, which is that word sensitivity. So it's not the same, it's not an immunologic reaction. And so when I test that person to gluten, I have to do a blood test for gluten, okay? And they come back negative. That means they don't have the antibodies for gluten sensitivity, but they still could be intolerant. And what I find a lot in people, children and adults, that they'll say, well, I'll say, why do you think you have gluten allergy? Yes, genetics plays a large role in it. And, often I'll have a mom and a dad and children, and they'll all be allergic in patients. With that said, I have a number of families that come to mind where mom or dad has allergy, the other parent does not, and then their children are split, 2 or 3 of them may have it and the other 2 or 3 don't. And it's really interesting because some of them will test really strongly for allergy. And so they'll bring the other child in and then you test them and they're like completely negative. So yes, genes play a role, but it's not absolute. The other factor that seems to be playing a role, and this is going to sound maybe a little weird, but it's called the hygiene hypothesis. And what the hygiene hypothesis says is that if children early on they have very little exposure to viruses and bacteria, and they're just kept in this sterile world, if you will, then the immune system doesn't have as much work to do. And so it tends to skew more toward the allergic part of it. And we call those T cells, allergic T cells, that the body will, because it's not fighting off a lot of bacteria and viruses, it will tend to skew more toward allergy. And they've looked at children raised on farms and with animals and find actually some less allergy there because their immune system was busy fighting off viruses, bacteria, and animal stuff. And so it sounds a little odd, but it may be best to not be quite as, squeaky clean as we usually like to do. It's a fairly common condition. It's called oral allergy syndrome. And so what happens in oral allergy syndrome is there is a cross-reactivity between certain fresh fruits, vegetables, and even some nuts and pollen allergy. And so there are similarities in the proteins in these fresh fruits, vegetables, and nuts, and the pollen. And so the body sees these as the same. And so what I tell people, it's like if you're allergic to birch tree pollen, for instance, it's like you're taking birch tree pollen and throwing it in your mouth, and your body just starts to react to it.
Wow.
Now, if your friend takes those raw apples and cooks them and puts them in a pie, she's not going to react to it, because there's what we call a denaturing, a changing of the shape of the protein when it is cooked. Therefore, it no longer looks like birch tree pollen, and they can eat cooked. So yes, oral allergy syndrome is real. They're not imagining it. It's not psychosomatic. And the way to prevent it is, number one, avoid that food, or number two, just simply cook that food and denature, change that protein shape so the body doesn't see it the same.
This is one of the best conversations I've had with a doctor in a long time.
It's important to you because you experience these things.
Yeah.
Absolutely. Yeah.
You know, and my kids have experienced them too, right? So I have two kids. One, when he was a kid, when he was, smaller, he wound up allergic to milk products. Now I'll call it allergic because he actually wound up like with fever and bronchitis, just like really not good, not good at all at 2 years old, He also had some kind of sensitivity to wheat that has subsided. He still has lactose intolerance, though, for milk. And the other one was highly sensitive to soy. Every time he ate anything with soy in it, he would vomit.
Oh boy.
How much fun is that out at a restaurant?
Yeah.
Let me tell you, at the table. So he had that, soy and dairy for him also, so I just imagine how many of these little ones, and they were little, they were 2 years old, 3 years old, 4, just starting school. How many little kids really are dealing with this stuff? And the parents are, I don't know. And if you go to your pediatrician, they may not be as astute as you are, well studied as you are about all this stuff. I guess they wouldn't be. And then you wind up, going down some other bunny hole with your kid and the allergies and the vomiting at the restaurant table, just.
Yeah, and that brings to mind something that I think is important for people to understand is sometimes the mom or dad will go in and say, little Johnny or little Susie I think they have food allergies. And then the doctor will run a blood panel. They're called PAP-RAS. They're called a RAS test.
Right.
And it'll come back with a list of, whatever, I'm going to make up a number, 8, 10, 12 foods that show up positive. And so they say, well, he or she's allergic to all these foods. Those types of things are very well known for having what's called false positives. So a person comes into me and they bring me a list of, I'm allergic to these 10 foods. And I was eating them just fine, or I was eating some of them just fine before my doctor checked all these blood tests. That's when I, will do some testing and I'll sit down and explain to them about false positives. So I'm always against just blanket, getting a large panel of food testing, particularly blood tests and even skin tests to some degree, because it's just can be very misleading. It's best if you take the time to distill down what's really going on. Is it a food intolerance? Is it a food sensitivity? Or is it a true food allergy? Eczema is a chronic relapsing skin condition, and lots of theories on what causes it. We talked about genetics. Skin barrier seems to be an issue. So one of the things that tends to work pretty nicely for some of these babies is using coconut oil as a moisturizer, because with eczema, there's two schools of thought: wet school, dry school. The dry school says, don't bathe your child very often because it's going to dry their skin out. The wet school says, bathe them more often because it's going to put moisture into the skin. I am a strong advocate of the wet school. And here's why. If you bathe your child and you let them soak in the tub for 15, 20 minutes, let them play, their skin is absorbing water. Have you ever noticed how sometimes you've been in the water a long time, you get these little wrinkles in your fingertips?
Yep.
That's water being absorbed in. The key thing is, as soon as that bath is over, you need to immediately get a moisturizing cream or lotion or oil onto the skin immediately to seal in that moisture, and your skin will be markedly better. And that's for people who just have dry skin too. And so I've taken literally hundreds, thousands of babies who come in and their doctor said, you know, only bathe them twice a week, 3 times a week, whatever. And I put them on the wet school. And all of a sudden, just within days, their eczema starts to get better because the more moisture you have in the skin, the less itchy they are. And so coconut oil is a good way to do it, or an unscented moisturizing cream. I like creams because they're thicker, they seal that moisture in. So I tell them, don't go answer your cell phone, don't go chase your other children, don't answer the phone, don't do it. Go immediately to the skin and get a skin moisturizer to block and seal that moisture into the skin. Because eczema is the itch that rashes. And the other natural remedy that I like to use is black cumin seed. Black cumin seed has strong antiviral properties. As a side effect, it'll actually help lower your cholesterol a little bit. And I personally just love black cumin. So my wife and I will, whatever we're eating that day, whatever soup or beans or whatever, we just sprinkle some black cumin in there, and very, very tasty and very healthy for you. And, you know, I don't like to have people, you know, zero in on, okay, I'm going to eat, you know, black cumin and therefore I'm going to be healthy. No, it's part of the whole food plant-based diet, because, you know, whenever science finds a food that looks like it's got a health benefit, what do they want to do? They always want to break down, well, what is it in that food that makes it healthy? Well, you know what? Sometimes it's 100 things in that food that make it healthy.
Yeah.
So when they tease out and make, you know, broccoli supplements, or they try to tease out this that was in this food and put it into a supplement, they don't get the results. And this has been tested time and time again. It's the whole food that tends to make the biggest difference. And so, so that's why I always hesitate, you know, if I say, well, blueberries are healthy. Well, blueberries are healthy as part of a, you know, complete whole food diet, but so are raspberries and blackberries and strawberries and all of those things. It's what can we do to help our bodies in fighting allergies and asthma and eczema and things like that? And there have been, there's not as much science research in asthma, allergy, and eczema and things like that than there is with like heart disease or diabetes and that sort of thing. But there is science there.
So powerful.
Yeah, learned so many things that I didn't even know played into allergies and asthma and all of it.
Right. Really.
Right. Well, it's been a privilege for me. It's a lot of fun to share this information with people, especially like you two, that I know you're going to share it with your listeners and your followers, and hopefully people will be healthier for it.
Yeah. And our goal is that, you know, if we can make it easier on the kids and by extension their parents, you know, to eat this way and to live a healthy life and to not have to deal with so many of the effects of sensitivities to food and environment or allergies and all kinds of things, you know, wouldn't that make the world a better place?
Yeah.
Yeah, absolutely.
We might actually work you out of a job. Wouldn't that be great?
Yeah, I mean, you know, and it all comes down to, and you said this, I think, Meryl, you said this earlier, I always want to know the cause of what's creating my problems. And I tell my patients, look, our goal is to always find the cause, but sometimes we're not going to find the cause. And so then I'm going to put you on the best treatment program to, you know, help take care of your symptoms. But if we're only treating the symptoms and not the cause, then we're doing a disservice. But I'm straight up and transparent. You know, there's certain conditions that I see frequently in my office that I'll tell them, we're probably not going to find the cause. We're going to look, but we may not find the cause, but then I'm going to put you on the best treatment for that. But when we can find the cause, oh boy, that really, you know, can be life-changing for people.
Yes,
Yeah, it
totally.
can, yeah.
100%.
And
Yeah.
it's, just talking with you today, you bring up so many different things that I think people don't even realize when they're trying to figure out what is causing something. So being able to talk with someone who can piece out all the little intricacies and dig down to the cause. Very
Yeah, we try. Sometimes people will give me a history and I'll just kind of go, oh boy. Not sure where to start on that one, you know, and we do. Sometimes I'll just take segments of what their issues may be and say, we're going to work on this right now, because if it's, you know, you try to shotgun approach too many different things, it doesn't work. So I try to, and almost always I'll bring it back to lifestyle and nutrition. And give them some things to start trying, and often they'll come in with, you know, GI problems and maybe some skin problems and whatever. You know, I'll rule in or rule out some allergy, but that's usually not where my thought process is. It's like, what can I do to help you with your lifestyle to then get your body back? Because, you know, our body's made to heal itself. If you put it in the right environment, you put the right stuff inside it, it'll heal itself. And in most cases, there are exceptions.
Right.
Yeah, perfectly said.
Yeah, beautiful. Well, again, thank you so much for your time and your willingness to share your expertise and your wisdom, and, you know, make a difference for people every day. I'm sure if I lived in Tennessee, I'd be at your office.
Yeah, we would come find you.
That's for sure.
Well, that's an ultimate compliment. Thank you.
Our pleasure. Our pleasure. All right.
All right. That's it.
I think we're done.
Great. Well, I hope to see you guys at a meeting someplace somewhere soon.
We'll make that happen.
Likewise.
That's for sure.
All right.
All right. Take care, Dr. Mike, Hollie.
Good to see you both.
All right.
Bye.
Bye.